So today I'm going to be performing the skill of catheter care. The first thing I'm going to do, I'm going to knock, identify, and greet the patient. I'm going to perform hand hygiene, and then I'm going to provide the privacy curtain. So the next thing I'm going to do is I am going to fill my basin with some water. And then I'm actually going to raise the bed rails on both sides of the bed, this side and this side, on both sides. And then after I raise the bed rails, then I'm going to raise the bed for good body mechanics. That way I'm not leaning over top of the patient. The next thing I want to do is I'm going to lower the side on whichever side that I am working on. I want to make sure that my patient is laying in the supine position. And I am going to drape my patient, and then I am, because we got pretend linens under here, so after I drape my patient, I'm going to fan fold the linens back to the end of the bed. After I do that, I'm going to put on my gloves, my disposable gloves, if I can get them on. So after I put on my disposable gloves, the next thing I want to do is I'm going to put the bed protector, and I'm going to place this underneath the patient's buttocks. I'm just going to gently just roll them onto their side. And I'm going to place them under there. Then I'm going to expose the perineal area. Okay, so after I expose the perineal area, depending on if it's a female or male, I am going to expose the labia or pull back on the foreskin. We'll pull back on the foreskin. I'm just going to check for anything that might be abnormal, like crust or any kind of drainage. Then I am going to Then I'm going to get my basin. I'm going to gently wash around the opening. Around the opening of the urethra with some warm soapy water. Then holding the catheter, I am going to clean the catheter about 4 inches down with a clean washcloth, about 4 inches down. I'm just going to hold and just clean the catheter, being careful not to pull on the catheter itself. Then after I wash with my soapy water, I'm going to get a clean cloth again, and I'm going to rinse with clean water and making sure that I am cleaning downward away from the perineal area with one stroke, not two like I was doing, but just one stroke. After I rinse, I'm going to wash as needed. If I need to do another wash, and I'll go ahead and repeat that. The wash, I'm going to use a clean washcloth each time. So then I'm going to pat dry. Be careful not to disturb the catheter too much. I'm going to pat dry after I've rinsed. So after I've patted dry, I'm going to make sure that the catheter is nice and secure and it's not coiling up or getting tangled or anything. I want to make sure that the catheter is secured to the inner side. So after that, I am going to move the bed protector. We're just going to roll my patient over to their side. And after we move the bed protector, then we're going to discard of the gloves. Then after I discarded the gloves, I'm going to cover the resident with the blanket, the bathing blanket. And I'm going to make sure that the patient is nice and comfortable. Then I am going to raise the bed rail. After I raise the bed rail on both sides, I'm then going to lower the bed back down. And I'm going to lower the bed rails on both sides. Then I am going to attach a single light with the resident. I am going to perform hand hygiene and record and report. That is my skill.